Hello, everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. A big thank you to all those who have subscribed to this channel. If you haven't yet subscribed and you want to learn more about your health, then please hit on that subscribe button and also on the notification bell so you would be amongst the first to see any video that I upload. Today, I'm going to be spending some time with you talking about a very common condition that occurs mainly in women. This condition is called vaginal thrush. It is also known as vaginal candidiasis, and some people even call it white because it's associated with a whitish discharge. This condition is a yeast infection and is caused by a fungus called candida. It is very common in women of childbearing age because in such women, estrogen levels are high, and this fungus loves to thrive in conditions that have very high estrogen levels. It is also a fungus that loves to thrive in very moist and warm conditions. A lot of women find it really hard to talk about this condition when they get it. You know, it is pretty common, and there is nothing to be ashamed of. Even though this condition occurs in the vagina, it is not a sexually transmitted infection. It is a fungal infection. This fungus, called candida, lives normally and naturally at low levels in the vagina. There is also good bacteria that lives normally in the vagina. These bacteria keep the levels of the fungus in the vagina low, and both the bacteria and the fungus work together to maintain a very good pH in the vagina. There are times when the levels of the bacteria gets disrupted, and when this occurs, there is excessive growth of the candida, and this is what causes the symptoms of vaginal thrush. The conditions that can disrupt the levels of the bacteria in the vagina include some antibiotics that we take. Also, people with a weakened immune system, and these are people with HIV or cancer. Also, people who have diabetes that is poorly managed. Pregnancy can also trigger a disruption in the levels of the bacteria in the vagina. Vaginal thrush presents with various symptoms, and these include itching and redness around the vaginal area. There is also a discharge. This discharge is odorless and is whitish in color. The discharge can be thick or it can be watery. Sometimes some people suffer vaginal thrush with no discharge at all. Also, there is pain during urination and pain during sex. There are some people who would definitely have to visit their doctor when they experience any of these symptoms. And these are people under the age of 16 and those who are older than 60. Also, if your discharge is associated with some smell and is colored. When you experience any bleeding with the discharge, then you would have to visit your doctor. If you're experiencing any of these symptoms for the first time, if you're pregnant or you're breastfeeding, also if you've had recurrent vaginal thrush, that is, you've had more than 4 episodes in the last 1 year, then you definitely have to visit your doctor. If you don't fall under any of these categories and you've got the symptoms of vaginal thrush, then you can visit your pharmacy and speak to the pharmacist, and they will be able to help you out. There are preparations that you can buy from the pharmacy. There's clotrimazole, there's iconazole, and there is miconazole. These are antifungal preparations that are very effective in the management of vaginal thrush. and these come in the form of pastries as well as creams. The pastry is in the form of a tablet that you insert in the vagina, and the cream is one that you would apply around the vaginal area. There is also a cream that you can insert with an applicator into the vagina. Most of the time, you would need a cream that you would apply externally and the pastry that you would insert into the vagina. And there is also a capsule that you can take. This capsule is just one capsule that you take as a single dose, and it is also very effective. These preparations, when used diligently and in the way that they've been asked to be used, can help the vaginal thrush to improve within 7 to 14 days. If after this period you don't see any improvement at all, then you would have to visit your doctor and speak to them, because it could be another type of infection, or it could be that you've got an underlying condition like diabetes that can cause vaginal thrush. There is a point of caution here. Because these preparations are oily based, they have an effect on certain forms of contraception. Condoms and diaphragms can break when you're treating vaginal thrush with these preparations and you use them. So there is a need to look for an alternative form of contraception when you're undergoing this treatment. There are some things that you can do that will make you feel comfortable and also prevent the vaginal thrush from returning. And these include washing the vaginal area with just water. Avoid using any form of scented soap. Avoid douching and avoid using deodorants in the vagina. Also, after washing, make sure you wipe the place dry. Wear cotton-made underwears and avoid wearing tight underwears. If having sex is uncomfortable, then wait till the condition improves before you have sex. I hope you have learned something new today. If you have, then hit on that subscribe button and also on the notification bell. Leave your comments, your questions, and your suggestions in the comment section, and I would attend to them as soon as I can. Also, don't forget to give this video a thumbs up. Thank you so much for joining me today, and I hope to see you soon in my next video. Bye for now.